Good afternoon, this is Aubrey and Jordan with Education, and today we're going to talk about how to administer a nebulizer treatment. So when you're giving a nebulized medication treatment, there's a couple things you want to be aware of before giving the medication. One is that it is contraindicated for patients who are tachycardic or have AFib. We also typically don't give these to patients who are ruled out for COVID. If you're going to give a nebulizer treatment, you do administer it at 10 liters of air or oxygen, and you can dilute it using normal saline and the little 10 ml saline bullets as directed by the physician in the orders. If you have multiple treatments, they can be given in the same canister. They don't have to be given each separately. However, if the patient is prescribed Mucomist, it does have to be given concurrently with a bronchodilator such as Duoneb. If a patient has a tracheostomy, we can still do a medication administration on those patients. You would just need to make sure that you use a trach mask to administer it. And then if they are on oxygen therapy prior to getting their treatment, make sure that you put them back on their oxygen therapy after they get their treatment so that they don't become hypoxic. If your patient becomes jittery or dizzy while they're getting their Duoneb or their nebulizer treatment, then we're gonna have you stop it for about 5 minutes while they calm down, and then try to resume the treatment and see if they're able to tolerate. Typically what happens is the patient hyperventilates because they're trying so hard to inhale the medicine and get it all in. They breathe too rapidly and too deeply, so just educate them on making sure that they're not doing that. So when you're going to administer this medication, there's a couple of things you'll need to have with you. One is that you're going to grab your nebulizer pack out of the supply closet. It's going to come with your neb kit and a tubing that you're going to need to hook up to oxygen regulator. You're also going to probably want to grab one of these aerosol masks, especially for patients who may not be able to create a tight seal on the mouthpiece with a regular nebulizer kit. And then when you open it, it's going to be a lot of different pieces. So we're going to show you how to go through and put everything together. So this bottom part is a canister that you actually put your medications in. When you squeeze things in here, you're going to go through this top port right here, which is open, and just squeeze it directly in to the canister. And again, you can put multiple medications in there at once. You're going to attach your tubing to this bottom port. The other side of your tubing is what's going to connect to your regulator at the end of around the wall. You have your connector here, and this is how you connect it to do a mouthpiece. You're going to have your blue tubing on the narrow ports, and then your mouthpiece is going to go on the wider port. Make sure that everything is screwed in really well, and then attach your tubing to your oxygen port. You will notice that as I was doing that, I was keeping everything level, because if you don't, then when you tilt your canister, your medication can leak back out. That's going to affect the amount of medication that your patient gets in. So you want to make sure that you're keeping it upright, instructing your patients as they're positioned to take their treatment that they remain upright as well. So they're going to put their mouth around the mouthpiece and create a tight seal. When you turn on your oxygen, you're going to turn it on to 10 liters, and you're going to hear that sort of whistling sound. And as you can see, it's starting to make that little vapor, which is exactly what we want. That's when they would start inhaling at the end of the mouthpiece there. That typically, depending on how much medication is in there, is going to last for about 15 minutes or so. When it starts to sort of sputter or gurgle, you want to tap on the chamber to make sure that you knock down any residual medicine into this little canister. And when it's completely run out, you just turn off your oxygen, and you can disconnect. I would suggest taking these pieces, these mouthpieces, and cleaning them, rinsing them out, and putting them somewhere to dry, and then putting them like in a patient belonging bag or something like that so they don't get contaminated or knocked over onto the floor. As with any other breathing treatment, we want to suggest that our patient swish and spit afterwards to rinse any medication out of their mouth so that they don't end up with thrush. Also with this medication, we have to go in and document that we gave the treatment, and also do assessment prior to giving the treatment. So you're going to go into your flow sheet tab, and if it's not already added, you're going to go in and search for respiratory. And make sure that you click on facility list. The respiratory assessment flow sheet is what we're looking for. And when you wrench that in, it's going to bring you to this screen right here. It's going to ask you for several pieces of information, including what kind of treatment type that you gave. So if this is your pre-treatment, then this is going to be, then you list it as your pre-treatment workup. What the delivery device is. So for this one, it would be the nebulizer. What the route is going to be. So we were able to use an oral mouthpiece. Heart rate, respiratory rate, status. So just a basic respiratory assessment in here. And you're going to do this prior to giving the medication and after giving the medication. As a note for the patients who are not able to use the mouthpiece and want to do the mask instead, you have the same setup, but you pull this piece off the top, you connect this mask, I'm just going to slide down like this, and then make sure that you put it over the patient's face and then pull to tighten so that it has a tight seal and it's not leaking. Because if you don't, and if you just have it left as a blow-by, then they're not gonna get the benefit of the medication. We don't wanna just hold it here and try and let them breathe in the medication from a distance. It really needs to go directly into their respiratory system. Hopefully this was helpful. If you have any questions, please feel free to reach out to Education.